I'm super excited to announce our guest speaker today. We have Kelly Kester with us. Kelly is currently has her Doctorate of Nursing Practice from Duke School of Nursing, and she's in a clinical operations director role at Duke Hospital. She helps support two of our ICUs here, as well as our cath lab, invasive lab, EP lab, cardiovascular short stay, patient response. She's been a bedside nurse, preceptor, charge nurse, nurse manager, overseeing orientation. So she's got a wealth of knowledge to kind of share with us today. And she's going to talk through some spotlight information today on authentic leadership. And we also have two of our sites that are going to share some real world examples from some of the stuff that Kelly is going to review today too. So we're super excited to have her. And with that, I'll let Kelly take over and just let me know when you are ready to advance.
Thanks, Heather. I really appreciate it. And thank you all for having me today. I'm really looking forward to talking about authentic leadership. And one of the reasons why I was excited to come and talk to you all who are doing the work day to day, particularly about authentic leadership, is because sometimes it can be seen as or at least in my eyes, the most ambiguous standard within the framework, and just kind of thinking to ourselves, really, how can we achieve this? And so, Heather, you can go on to the next slide. I only have two slides for you, and that is because I want to really focus on not necessarily defining authentic leadership, but storytelling a little bit about how I've been able to apply this to my work in the context of a healthy work environment. Now, you probably have read this definition, and what this means to me is just truly feeling the power of a healthy work environment and understanding that it really is something that is achievable, and it is something that truly does change the outcomes not only of our patients but our staffs as individual team members and the team overall. As a leader, it has completely changed my outlook on how I'm able to contribute to individual teams, whether that be when I was the nurse manager in the cardiothoracic ICU or as a director, and now being able to share best practices across multiple departments within a service line. Heather, why don't you click forward one more time? And when I look at the critical elements of authentic leadership, there's a lot of words on this page, on the page within the website that describes authentic leadership, but I like to break it down by the organization and how the organization contributes to this standard, how the leader themselves contributes, and then lastly, how the frontline nurse or other clinician contributes to authentic leadership, because we all play a part here. And one of the most common questions I get, and I know Heather also gets when we're talking about the healthy work environment framework, is what happens if the organization or the leader isn't really bought in yet on healthy work environment? And so I like to talk through that a little bit here today. From the organization's perspective, there are clearly resources that need to be allocated, whether that be specifically to developing leaders, providing frontline clinicians with educational opportunities, or just simply putting the right people in the right roles. So specifically when it comes to nursing leadership positions, I believe that frontline nurse leaders, whether they be titled nurse manager or charge nurse, assistant nurse manager, you all are the most valuable folks within a nursing team within an organization. There is no one that is going to work harder, and there is no one that is going to have more influence over the ability for a team to be successful. But that being said, the organization needs to know who is prepared and staged appropriately to grow into a leadership position. Once you are in a leadership position, you can contribute to authentic leadership by participating in that available education, or seeking resources through AACN, AONL, or other organizations that are available. seeking mentorship, I think, is probably one of the most important and underrated opportunities for individuals, whether you're in a leadership position or not. And I say that because it's one thing to discuss what you're faced with day to day with someone who's in it with you, and it's another opportunity that you are posed with within mentorship to talk with someone who's been through it before and might have some lessons that they've learned that you can learn from as well. And then lastly, as a leader, fully committing to the thought of the healthy work environment framework and walking that walk day to day and understanding that, today you might focus more on meaningful recognition than skilled communication, and that's okay. But in some, you're really focused on driving it home that we are living a healthy work environment. We might not be perfect. We're likely not perfect, but everything that we do and every decision that we make is or should be leading you towards achieving or fulfilling one of the standards within the framework. And I myself, and I'll talk about this in the next slide, I utilize that and I have a visual all the time of which bucket or standard is this contributing to? Are my buckets getting a little light in, shared decision making or meaningful recognition, but I'm really heavy on communication. There are things that, I just prospectively have a sense on as a leader. And as you grow more confident and comfortable with the framework, then you can choose to practice in that way as well. And then lastly, and of course, just as importantly, the frontline nurse or other clinician or role, how can you live and achieve authentic leadership? And it's one, just role modeling the behaviors that lead your team towards a healthy work environment. That is the number one thing that any team member, but particularly a frontline nurse, that is what you have control over. What do you want your team and what your work environment, what do you want that to feel like every day? Do you want it to be a welcoming environment? Do you want it to be an environment that stands up others? That is what you want. Now, also, this is not easy. There are times where, contributing to either a work environment or committee work, it's not something that is always going to be a I want to say, I guess easy is the word that comes to my mind, but it's work. We have to lean in and make sure that we are contributing to where there is a need. So whether that be on committees, developing committees, it could be engaging in professional organizations, as all of you are here in this collaborative, which is amazing, and bringing that work back to your department. We have to identify as a frontline team member, what are the opportunities that are there for me? And those are the things that we need to engage in and then continue to grow and contribute back to our home department. Heather, I'm going to have you advance again. And I have 5 different examples here that are things that I either have done or do in my practice. And the first is leading a hospital-wide, Heather mentioned I work for Duke University Hospital in North Carolina. We have a healthy work environment initiative across the organization, and there are several leaders of us that help focus on a different standard, and mine is appropriate staffing. Staffing and workforce development are something that are near and dear to my heart, and it's something that I spend a lot of time and effort in researching and doing some quality improvement with. And so this is one mechanism that I have not only to give back in regards to the lessons that I've learned, the skills and the knowledge that I've built over time. I've been in leadership about 10 years or so. And prior to that, I was at the bedside for about 6 or 7 years. So I've been doing this work for a bit of time, and it's my duty as someone who lives a healthy work environment framework to recycle what I've grown or known and learned over time back to others who are coming up behind me. That is my duty as any leader, frontline nurse, you name it. It's to grow our own and to help contribute to others' development. And so through leading the appropriate staff committee, I'm able to do that. I don't expect that everyone's going to read every paper that comes out in the journals and listen to every webinar. I wish they would, but we can't all do everything. And so we have to be really good at disseminating and sharing and cross-pollinating our knowledge. And so this is one way that I do that. Second is that I serve as a mentor for frontline nurses and leaders. I do have people that independently seek out mentorship from me. I've also been asked to mentor individuals by other leaders just based off of their personality or what they're interested in. And then I've also just volunteered through our Duke University School of Nursing. We have a formal mentorship program through the school that I've volunteered as a mentor for. And through that program, we essentially go and have a meet and greet, and then the mentees will select who they think they pair the best with. And I've had some really long and strong relationships with my mentees, but I have learned how to mentor others by being a mentee. You're never too experienced, too young, too old to engage in mentorship. And all of us have things that we can learn from each other and then also contribute to the other's growth and development. As a mentor, I will tell you, I think I probably learned more from my mentees than they learned from me. That's how I feel about these relationships. They're so incredibly important. And so I cannot highlight this enough. The third example that I want to share is nurse leader development is another aspect of my practice that I certainly prioritize. I believe that nurse leader development at this time in our profession is likely one of the most important priorities. And the reason why I say that is because many of you, again, regardless of the role that you're in, may recognize that when you become a formal nurse leader, whether it be a charge nurse or a nurse manager, we really lack formal education, onboarding, and transitioning into leader practice. And it's something that we desperately need. The education and resources that are available are often a little inaccessible, either due to cost or time commitment. And that leads us to, as leaders, just learning on the job. Which and sometimes is a good way to learn, but research shows that it takes about 7 years for new leaders to become fully proficient in the leader competencies denoted by AONL. That's too long. We don't have 7 years to wait. And so when it comes to the hard skills that I kind of see falling under that appropriate staffing bucket, for example. So, the hard skills of calculating FTEs, understanding how to hire nurses, when to hire, things of that nature, human resource management, that leans into a little bit of a softer skill. How do we balance the learning of these practices when we often don't have necessarily a strong transition from the previous leader to the new leader? So this is something that I've really focused on creating educational activities, done some simulation, tabletop simulation with leaders to talk through certain things. Heather has posed as an actor for me in many different roles, and she's very good at pretending to be an angry or a not so happy staff member, I'll say. She's really the nicest person that I work with, so it's kind of funny to see her in that role, as many of you can imagine that know her. The fourth thing that I'll share is engaging in innovation. Innovation is something that I obviously knew about, you hear about, you're like, what is innovation? What does that really mean? And it means a lot of different things. We develop a new process. Those of you that are engaged in this work, you're all engaging in some form of innovation by thinking about things in a different way. And then there's also things like you're actually developing something, whether it be a product or whatnot. And so I really was thinking a lot about innovation in the sense that I had ideas, but I didn't know how to get there. And I decided to take the leap one day and say, to my organization that we're blessed to have opportunities to get support with our ideas for innovation. I submitted my idea, I kind of threw a Hail Mary, and I was like, I really think that we need this solution. And it's related to workforce stability, and it's a tool for frontline nurse leaders and leaders throughout the organization. And I've been able to develop this tool or this resource over the last 18 months to 2 years. And not only have I learned a lot about innovation, I've been able to engage a lot of different folks, nursing and non-nursing, in a process that we would call co-creation, where we bring in folks that are not from healthcare to develop solutions to our problems. It's nurse-led. I want to be very clear that this is a nurse-led innovation. However, we don't have the full capability of, for example, product development, certainly not software development, which is kind of the world that I'm living in right now. I'm learning a lot of words that I never would have learned otherwise. But it's really important to bring in the perspectives and skills that we don't have. And sometimes that's not going to be nursing, and that's okay. But we want the innovation to be nurse-led. I want to throw a plug out. I know that I need to transition it back here shortly, but I want to put a plug out. The American Nurses Association just had their Magnet conference, and within that, they had what they deemed their nursing innovation row, and I was lucky enough to be a part of that. And there were 24 nurse entrepreneurs and innovators there. And I have to say, it was incredibly encouraging to see the amount of ideas, collaboration, and creativity of nurses out there. So just know that if you have an idea, an aspect of authentic leadership is going for it. And the idea might fail, but failure is a part of the process. You might have that kind of 1 in a million idea that really changes the landscape, but you also might have a really good idea that improves the practice on your individual department, either for onboarding and orientation or some sort of clinical practice. So again, just go for it. And then lastly, dissemination. I've mentioned it a couple of times already. Contributing to or participating in quality improvement or formal nursing research, any sort of science, is incredibly important because, like I said, failure is good too. We need to know what doesn't work, so that way we continue identifying what does work. And we need to disseminate, so that means create a poster, have a publication, do a presentation at NTI, whatever that might be, and share the pits and the highs of what your experiences have been through this work, because we're all learning from each other, and we want to expose that not everything is going to go well. We might have what we think is the best idea and it just doesn't work, and that's okay. But we want to tell that story so we don't waste more resources trying it again in the same scenario. So those are 5 things. I know that was quick going through, but there are 5 things that all of you can kind of think about and let seep in how you might contribute to authentic leadership, which, like I said, is kind of one of the more, I think, more difficult standards for me, at least, to get a grasp around at first. So thank you for your time.